This project was funded by Genzyme's Patient Advocacy Leadership Award to the Organization for Rare Diseases India and the RareGenomics Institute in 2016. Information about Nieman-Pick disease types A and B for patients, parents, and caretakers. Overall, Nieman-Pick disease is a very rare autosomal recessive disease. Nieman-Pick disease comes in two forms, type A and B. When the SMPD1 gene produces a deficient amount of acid sphingolomyelinase, ASM, Nieman-Pick disease is the result. The amount of ASM produced can vary significantly, causing the symptoms to range from mild to severe depending on the variant. While Nieman-Pick disease can affect all ethnic groups, Nieman-Pick disease type A is most prevalent in the Ashkenazi Jewish population. Signs and symptoms for Nieman-Pick disease type A tend to be both severe and somewhat consistent between patients. Patients have little to no ASM enzyme activity, and typically symptoms present in infancy and progress quickly. Death often occurs by age 3. The most prevalent symptom is relentless neurodegeneration. Frequently, there are developmental delays. Often, milestones that have been reached before symptom presentation will be lost. Patients are likely to suffer from hepatosplenomegaly, which is an enlargement of the liver and spleen. There is also a risk of lung disease caused by an excess of sphingomyelin in pulmonary macrophages. Type B, Nieman-Pick disease, is defined as any diagnosis other than type A. This causes both the severity and the number of symptoms to vary greatly between patients. Symptoms can present any time between late childhood and adulthood. Symptoms tend to be more mild than Nieman-Pick type A, and therefore can sometimes be or undiagnosed for many years. However, the symptoms of Nieman-Pick type B can be similar to or affect similar organ systems as those affected by Nieman-Pick type A. For example, the liver and lungs are affected. Patients can suffer from hepatosplenomegaly and impaired pulmonary function. As ASM builds in the lungs, function gradually degrades and can lead to recurrent bouts of pneumonia and respiratory failure. Liver damage ranges from mild to so severe that patients suffer from cirrhosis and failure. Patients can also experience developmental delays that will affect puberty and skeletal maturation. These symptoms do affect quality of life and can, if severe enough, cause death. To diagnose Nieman-Pick disease, the symptoms must be identified first. Next, leukocytes and fibroblasts are tested for ASM activity. These activity tests can help determine the type of Nieman-Pick disease present. However, genetic or biochemical testing must also be done. An evaluation by an ophthalmologist to diagnose macular cherry red spots is also necessary. Typically, the older a patient is at diagnosis, the better the outlook. Prevention is the best method for reducing the prevalence of this disease. This can best be done by genetically testing for carriers. This is usually done by parents before trying to conceive. Testing can also be done at several stages during and after pregnancy. The earliest would be pre-implantation testing via IVF treatments. Embryos can be chosen that are healthy and do not carry a mutation for Nieman-Pick disease. Testing can also be done via chorionic villus sampling at 10 to 12 weeks or via amniocentesis at 15 to 18 weeks of pregnancy. To test for Nieman-Pick disease in newborns, a dried blood spot test is performed. Living with Nieman-Pick disease can be done. It requires a team of doctors, pediatricians, neurologists, hepatologists, and ophthalmologists. Physical and occupational therapies will help prevent the muscle tone loss associated with Nieman-Pick type A and help to counteract the skeletal complications associated with Nieman-Pick disease type B. Nutritional monitoring is also important. Vitamin D and calcium levels must be maintained. Hepatosplenomegaly and pulmonary function must be monitored as well to catch any complications that arise as early as possible. There is research dedicated to studying Nieman-Pick disease. Most trials study stem cells or new drugs for treatments. Treatments for Nieman-Pick disease are largely limited to treating the symptoms of the disease. There are a few treatments that are currently being used. These include liver transplants, stem cell transplants, and enzyme replacement therapy. A liver transplant is used to reset the damage of the organ. This can be successful but comes with its own list of complications. The patient will require immunosuppressant drugs to prevent rejection, but that does not guarantee that the organ will be accepted. Graft versus host is a common concern for stem cell transplantation. It has shown some success with Nieman-Pick type B, though not with Nieman-Pick type A. Enzyme replacement therapy has also shown positive results and has worked for other lysosomal storage disorders. Research is still ongoing, but there is one drug that has been effective for Nieman-Pick type B. The drug showing the most promise is olidudase alpha. Although still undergoing research, it has been shown to be effective against Nieman-Pick type B because as the symptoms worsen and the disease progresses, the dosage can be increased to match. Other treatments, such as blood transfusions and oxygen treatments, work to counteract the symptoms of Nieman-Pick, although they don't actually treat the root cause of the disease. All of our data was gathered from the following resources. Thanks to the Organization for Rare Diseases India and to the RareGenomics Institute for funding this project.